See, see, where do you find the extraocular muscles? In the orbits, isn't it? So, first of all, you should know to take you to the skull bone. The skull bone.
Yes,
Yes,
ma'am.
Niharika. Okay. See here, the extraocular muscles are the muscles which control our eyeball. Okay. So we have superior rectus, inferior rectus, medial rectus, lateral rectus, superior oblique, inferior oblique. All these muscles are actually coming from the various bones which are present in the orbit. So if you can see the whole skull bone, one individual skull in the orbit has been just enlarged and it is shown for us. So this is the roof of the orbit. So what are the various bones? Can you read for me? Which is forming the roof of the orbit? You are seeing frontal bone, isn't it? Then this violet in color, this bone is sphenoid bone. Small green in color, you are finding is ethmoid bone. Are you able to see the same screen? Please stop me if you can't see. Okay, this is floor. In the floor, we have maxilla bone. Floor is this. So if you see the whole skull here, this becomes the maxilla bone, isn't it? So floor is formed by maxilla, then zygomatic bone. Lateral wall is formed by again zygomatic bone and the frontal bone. Okay, actually this is called as zygomatic process of frontal bone and this is called as frontal process of zygomatic bone which forms the lateral wall. Now this is near the midline. So on the medial wall we have again what is this bone? I said maxilla. Okay, frontal process of maxilla, maxillary process of frontal bone. So simply whatever yellow in color you are seeing is frontal bone. This is maxillary bone. This is zygomatic. Inside you find sphenoid bone. In the sphenoid we have two wings. Greater wing of sphenoid bone, lesser wing of sphenoid bone. Between the two sphenoid bones you are finding an opening. This opening is superior orbital fissure. If you have skull bone with you, you just try to check this hole inside the orbit. So this opening is superior orbital fissure. What are the structures passing through superior orbital fissure is also one of the short note. So he's here within this greater wing of this sphenoid bone. We are finding there is an opening which is called as optic canal. Optic canal gives passage to optic nerve. Okay, so on the medial wall, not only we have maxilla and frontal bone, we also have, see this red in color is lacrimal bone. Very close to lacrimal bone, we have ethmoid bone. Okay, one small yellow small piece of bone is seen, that is palatine bone. So why I'm talking about so many things in the orbit, because when you talk about extraocular muscles, we will come across certain names and these names should not sound to you new. Okay, we should know the bones which take part in the formation of orbit. Is it clear? Did you get an idea how the orbit is made up of? See, these two bony sockets which are lodging the eyeball are nothing but orbits. Okay, so superiorly we have frontal bone, inferiorly we have maxillary and zygomatic, medially again frontal, like maxillary, then lacrimal, ethmoid, and this sphenoid bone we have. Again on the lateral wall, this is zygomatic, frontal we have sphenoid bone. Between the, this is greater wing, this is lesser wing. Between the two wings of this sphenoid bone there is an opening. What is the name of the opening? Superior orbital fissure. Within the greater wing you have a hole for the passage of optic nerve. Optic nerve is second cranial nerve. So the optic canal gives passage to the optic nerve. Okay. So this picture you should understand in order to know the muscle attachments of extraocular muscles. Okay. So I will also show you some more pictures, mm, so that I will show you one more thing, that is cranial fossa. Please be patient till it gets opened. You need to retain this information in your brain while I teach you the origin insertions. Now see here, you are seeing the cranial fossa. What do you mean by cranial fossa? The skull cap has been removed and you are finding the cranial cavity. The cranial cavity has three subdivisions. We divide it into anterior cranial fossa, middle cranial fossa, posterior cranial fossa. Now just now I was talking about the optic canal. I told you optic canal is the passage which is giving it's an outlet for which cranial nerve? Second cranial nerve, that is optic nerve, is passing through this passage. Okay. When we have done tentorium cerebelli, I told you about this pituitary fossa also. Anterior clinoid process, posterior clinoid process. Of course, for now we don't require. Whatever green colored structures are nothing but these are the roof of orbits. That means if you break this roof, you will be entering into the orbital cavity. Okay, I'm just trying to give you a 3D image of where the eyeballs are placed, and this is optic canal. And whatever bone is seen here in red color or pink color, this is actually sphenoid bone. Okay, this sphenoid bone, we have two wings. You see, this upper one is the lesser wing and this one is the greater wing. So between, this is lesser wing, the above one, and this whole butterfly shaped bone is sphenoid bone. Between the greater wing and lesser wing, here we have that superior orbital fissure. If you have skull bone, open skull, you can see this point. You will have hole passage like this, opening like this. Okay, between lesser and greater wing, you have an opening, that is superior orbital fissure. The same fissure I have shown you in the orbit also. Okay, so all these bony names you should know in order to understand the origin insertion of extraocular muscles. Okay, this green color is frontal bone. Actually, orbital plate of frontal bone it is called as, because it is forming the roof of orbit. And this middle yellow color bone is cribriform plate of ethmoid bone. This is not concerned with orbit, but still I am telling this because this comes in the roof of nose. When we study nasal cavity, cribriform plate of nasal bone, cribriform plate of ethmoid bone forms the roof of nasal cavity. So on either side, these green plates are frontal bone. To be more specific, orbital plate of frontal bones. What is this opening? Can you tell me logically? We have finished this class. There is an opening in the frontal bone, empty space in frontal bone. What is the name of this empty space? Anyone? Frontal air sinus. Day before yesterday we have studied, isn't it? Okay. So this is optic canal, superior orbital fissure, lesser wing of sphenoid bone, greater wing of sphenoid bone, then superior orbital fissure. These names you just keep in your mind. Then we will go with now power point of orbit. One of you speak to me, no? So it will be easy for me whether you are seeing, understanding. Are you seeing this? Just a minute. It's opening. What are you seeing on the screen? Contents of orbit.
Yes, ma'am.
Ah. So in this contents of orbit, so now you will understand whatever I am talking, because now you have got oriented with the bones nearby. Okay. See, contents of orbits. The orbits are nothing but bony cavities loading the eyeball. So surrounding the eyeball, we have extraocular muscles. We also see nerves, blood vessels, and lacrimal gland also. Okay. So for now, you need not know all this. So we have extraocular and intraocular muscles. So see here. So this thing, whole thing is actually eyeball. Okay. From the eyeball posterior aspect, I told you we have second cranial nerve. What is the name of this second cranial nerve? Optic nerve. Okay, what is the passage through which the optic nerve is exiting outside? That is optic canal. Okay, so now let us see what are the various extraocular muscles we have. We have four recti. Superiorly, the muscle is superior rectus. Below this, we have inferior rectus. Near the midline, we have medial rectus, and laterally, we have lateral rectus. Okay, very simple names. We have four recti: superior rectus, inferior rectus, medial rectus, lateral rectus. Then we have superior oblique and inferior oblique. Okay, apart from that, we have one more muscle in the eyelid, which is actually elevating the eyelid. You call it as levator palpebrae superioris. Levator means it is elevating, palpebrae means eyelids. Because it is present in upper eyelid, you use the word superioris. Okay, levator palpebrae superioris. Okay, apart from that, we have many involuntary muscles, that those are not required, beta. So these four recti muscles, they are actually starting from common tendinous ring of Zinn. What is this common tendinous ring of Zinn? I told you we have optic canal, okay, through which the optic nerve is passing. Surrounding, see, this is the optic canal, and you see the optic nerve is passing through the optic canal. I told you what are these two bones. If you have really paid attention and if you have understood, I told you we have sphenoid bone, greater wing of sphenoid. See, the above one is lesser wing of sphenoid, and below one is greater wing of sphenoid bone. Between the greater and lesser wing of sphenoid bone, I told you we have a fissure. What is the name of the fissure? Superior orbital fissure. Superior orbital fissure. Make a note, superior orbital fissure is also 3 marks question. 3 marks question. What are the structures passing through superior orbital fissure? You are supposed to list out these structures also. So what are the various nerves you see? We have abducent nerve, which is the sixth cranial nerve. Okay. Then we have oculomotor nerve. Oculomotor nerve is third cranial nerve. This oculomotor nerve has two divisions, like it has upper and lower divisions. Okay, so I'm telling you easy nerves first. Okay, so then apart from that, fifth cranial nerve is trigeminal. Actually, fourth, fifth, sixth, all cranial nerves are passing through this. Okay, so what is fourth one? Trochlear. Okay, to make it simple, I will tell you like this: which cranial nerves? They all are concerned with supplying of extraocular muscles. Okay, so we have fourth, fifth, sixth cranial nerves. Fourth one is trochlear. Fifth one is trigeminal, not directly but branches of trigeminal, like nasociliary is going. If you can't remember nasociliary, you can write branches of trigeminal, which is fifth cranial nerve. Sixth is abducent. Okay, and third one is oculomotor. 3, 4, 5, 6 you write. Okay, so what is the third cranial nerve? Oculomotor. Fourth cranial nerve? Trochlear. Fifth cranial nerve? Trigeminal. Sixth cranial nerve? Abducent. 3, 4, 5, 6 cranial nerves are passing through superior orbital fissure. 3, 4, 5, 6. Okay. Then many names you are finding, no? That is nasociliary, frontal, lacrimal. This nasociliary, frontal, lacrimal are actually branches of trigeminal. Direct trigeminal is not written here. Actually, they are named as nasociliary, frontal, and lacrimal. Okay, apart from that, you are finding one artery, which is a branch of ophthalmic artery and a tributary of ophthalmic vein. Like you have superior ophthalmic vein, inferior ophthalmic vein. So in this way, it is easy for you to remember. How will you remember? Third, fourth, fifth, sixth cranial nerves, ophthalmic artery, and two ophthalmic veins, superior and inferior ophthalmic veins. These are passing through this superior orbital fissure. Now this is our optic canal. Optic canal gives passage to which structure? I said optic nerve. In the skull bone, only two areas are shown here now in order to show the origin of extraocular muscles. Surrounding the optic canal, there is a ring. The name of this ring is common tendinous ring. So this common tendinous ring gives origin to all extraocular muscles. See here, what are those? We have superior rectus, we have inferior rectus. Near to the midline, we have medial rectus. Away from midline, we have lateral rectus. It's not labeled like this. Okay. All four recti muscles, they are originating from this common ring. What is this? Common tendinous ring of Zinn. Okay. Then apart from that, you are finding the other muscles also, no, like superior oblique. What is this underlying bone? We have lesser wing of sphenoid bone. Okay, so superior oblique is coming from lesser wing of sphenoid bone, whereas inferior oblique will be coming from this area. What is this bone? I said maxilla and frontal, they form the floor of the orbit. Inferior will be from down, superior will be from above. Okay, so you are finding the origin of these extraocular muscles. So optic canal is giving passage to optic nerve. Not only that, it is also giving passage to ophthalmic artery. So a complete picture I have explained you. I hope you understood. If not, you stop me. Niharika, understood?
Yes, ma'am.
Huh. So that means surrounding the optic canal, we have common tendinous ring of Zinn, which is a common point of origin of all muscles. Superior rectus, inferior rectus, medial rectus, lateral rectus. From the lesser wing of sphenoid bone, we have superior oblique. Levator palpebrae superioris also. Okay, this is the superior orbital fissure which gives passage to third, fourth, fifth, sixth cranial nerves, ophthalmic artery branches and ophthalmic vein tributaries. Okay, once you know the origin, see the four recti muscles, they are originating from common annular tendon. You also call it as common tendinous ring of Zinn. The ring is attached to the middle part of the superior orbital fissure. Okay, middle part and also surrounding the optic canal. It is something like this. Okay, then insertion. See, in order to understand insertion, it's always good to understand with this picture. See here, this is our cornea. Okay, and surrounding we have the sclera, pupil, cornea and sclera. So should I take you to a normal eyeball picture? Okay, I'll take you to normal eyeball picture. Just wait. You finding like eye muscles on the screen, beta, with blue background?
Yes, ma'am.
See here, this black, usually for Indians it is black. So this black part of the eye is actually cornea and this white part is sclera. And this area, the sclera and cornea, this black circle area is actually called as sclerocorneal junction. Sclerocorneal junction is also called as limbus. Okay, limbus. So now all our extraocular muscles are actually inserted at some millimeters distance, like 4, 5, 6, 7, like that. 4 millimeters, 5 millimeters, 6 millimeters, 7 millimeters distance from sclerocorneal junction. This area is sclerocorneal junction. We are supposed to measure it from sclerocorneal junction. So superior rectus is inserted above, inferior rectus is inserted below, medial rectus is inserted towards midline, and lateral rectus is inserted laterally. Okay, now see, this is I hope you understood this picture. Once you know this, now see superior rectus, what does it do? It is actually helping in elevation of upper eyelid. to move the eyeball upwards, we have superior. Upward movement is superior rectus, downward movement is inferior rectus, inward movement when you move your eyeball towards medial side, that is medial rectus, and outward movement is brought about by lateral rectus. Apart from that, we also have superior oblique, no? So this superior oblique is responsible for downward and outward movement, and inferior oblique is responsible for upward and outward movement. Okay. So here you have this picture is giving very good information about the origin insertion of extraocular muscles along with their functions. Okay. So we will go back to our PowerPoint now.
Ma'am, superior oblique upward and outward, ma'am.
Yes, Peter.
Superior oblique is for upward and outside, ma'am.
Outward, yeah. Superior oblique is downward and outward movement. It is in oblique direction, no? So it is not upward, though it is above. Here also inferior oblique, though it is below, it is upward. The function is opposite beta because they run in oblique directions. So when they contract, they pull the eyeball upwards because the insertion comes this side. Okay. All the other four muscles are very easy. Superior is up. Recti muscles are correspondingly working. Superior rectus above, inferior rectus below, medial rectus medially, lateral rectus laterally. But superior oblique is pulling this eyeball downwards and outwards. Inferior oblique is pulling it upwards and outwards. Is that clear, Niharika?
Yes, ma'am.
The direction of muscle is in oblique. Okay, it doesn't come straight. Okay, hence the function is also, it's moving in a different direction. Okay. So now you will understand better. So insertion point also we will understand because we have seen the diagram now. So are you finding the PowerPoint now?
Yes, ma'am.
So all the recti are inserted into sclera a little posterior to limbus. What is limbus? Sclerocorneal junction. Okay. Tendon of superior oblique, just now you have asked, it is passing through a fibrocartilaginous pulley. I'll show you this. In the diagram only it was there. See here. Superior oblique is actually passing through fibrocartilaginous pulley. It is going below superior rectus and then it is getting inserted below lateral rectus. Okay, this is superior oblique. Then inferior oblique is actually coming from the floor of the orbit. Okay, it is going below inferior rectus and it is getting inserted like below lateral rectus and also below superior oblique. You are supposed to draw this diagram. By looking at this diagram only, you can frame the sentences also. Okay. So tendon of superior oblique is passing through that green area, fibrocartilaginous pulley, which is attached to the frontal bone. Okay. Inserted into the sclera behind the equator. Equator is the central part of the eyeball between superior rectus and lateral rectus. Inferior is fleshy throughout. It is inserted close to superior oblique, little below superior oblique, we have insertion of inferior oblique. Okay. So levator palpebrae superioris, actually it is splitting into two lamellae, like superior and inferior lamella. Superior, that means this is actually splitting like this. Superior lamella, just simple things you try to understand. It is inserted into the skin of upper eyelid. Inferior is inserted into, like conjunctiva is like a thin membrane which is covering the eyeball and which is also reflected on eyelids is actually conjunctiva. That means inferior lamella is deep and it is getting attached to conjunctiva. This word is enough. Inferior lamella is inserted into conjunctiva. Better you write upper eyelid, no? That's why superior conjunctiva. Okay, so these are origin insertion things about all these muscles. But I will repeat, maybe you have little confusion. So first thing is, I told you, we have four recti: superior rectus, inferior rectus, medial rectus, lateral rectus, superior oblique, inferior oblique. Okay, and levator palpebrae superioris. That is the list. When you talk about these muscles, first thing is, the origin is common tendinous ring of Zinn. Four recti, very easy. Okay, then superior oblique is coming from the lesser wing of the sphenoid bone. Even levator palpebrae superioris is also coming from lesser wing of sphenoid bone. Okay, all these four recti are getting inserted into the which part? Sclera. Okay, few centimeters away from sclerocorneal junction, which is also called as limbus. Okay, so that is we have. Then after that we have seen superior oblique, which is passing through this trochlear pulley. It comes below superior rectus and gets inserted just below lateral rectus. Inferior rectus is coming from the floor of the orbit, running below the inferior rectus and getting inserted below superior oblique. Okay, then levator palpebrae superioris, I told you it splits into two lamellae. The upper one is getting inserted into the upper eyelid, the lower lamella is going into conjunctiva of upper eyelid. Okay, so now all these extraocular muscles, they are supplied by, you just remember, SO4 LR6, and remaining all muscles by third cranial nerve, that is oculomotor. SO4 in the sense superior oblique is supplied by fourth cranial nerve, that is trochlear. Lateral rectus is supplied by sixth cranial nerve, that is abducent. Remaining all extraocular muscles are supplied by oculomotor nerve. Okay, so that's what you have to understand in this answer. Origin we saw, insertion we saw, nerve supply we saw, action we saw. Okay, so this is, it's given in a very simple way in your textbooks, but to make you understand I had to use so many pictures. Okay, I hope you understood. So like here, this is actually Chaurasia's pictures we have. So this is one inferior oblique. Movements are shown in this direction. If it is shown in up, that means it is elevation, and then this direction shows lateral rotation. Okay, so this is lateral rectus. That means this is also helping in lateral rotation. When you talk about superior rectus, you can see it is helping in elevation, and also it is helping in medial rotation. Just check these arrows like this, practice this diagram so that you can write in your own words. This diagram is must. Few students have already started answering and they have sent their answer sheets. I didn't share in the group also. I need to take their permission before that. So that will benefit you individually. That will help you to grow. So up to you. Everybody is starting now. They are submitting answers. I am very happy. Okay. What is the next question we have? Mammary gland. Okay. Till I open mammary gland, try to